Today we're going to do the Thomas test. The purpose of this test is to assess the flexibility of the hip flexors, the rectus femoris, and the sartorius. So the first thing we need to do is make sure that our client doesn't have any low back issues. Do you have any low back issues?
I do not.
Great. So we want to ensure that they don't have any low back issues because the assessment can put a little strain on the low back when they're in the testing position. The first thing I'm going to have you do is get into the starting position. You're going to rest your glutes on the edge of this bench. You're going to reach up behind your right knee, grab with both hands, and you're going to lay back into the table. Once you're laying here, I want you to relax, and I'm going to take a few measurements to see where each of the 3 locations are on our goniometer. I'm going to help you lay down into the table, so don't feel like you're going to fall and just bonk off, okay? So why don't you go ahead and come over to the side, Hannah. Great starting position. Grab behind your right knee for me, please. Great, and just go ahead and lay back. Awesome. I want you to just relax, and from there we'll take a couple measurements. Okay, great. Now that I have the measurements, I'm going to have you switch legs. So I'm going to help you pick this leg up. Grab behind your left knee, please. Great. Relax. Stay there, and now we're going to take a couple more measurements. So now I want to help you stand up. On the count of 3, we're just going to stand straight up, okay? 1, 2, 3. Great job. A couple common mistakes on the Thomas test is when we have our client initially start. Sometimes we may have the client sitting too far up on the bench, so their glutes are all the way up, and that's one of the issues we need to address. So our client right now is in the proper position. Sometimes you'll see our client maybe sitting up a little too far. And this is not where we want to start the test. Another common issue that we have is sometimes our client may grab on the top of the knee. We don't want our client to grab here because it may put a little extra strain on the knee joint, so we always suggest grabbing behind the knee joint, like so. Make sure that as your client lies back, you're there to assist them so that they feel comfortable and also so that they are safe. The next thing is you need to ask your client to relax. Most of the clients don't understand what you mean when you say relax, so sometimes coming up and saying relax, 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 relax will help them to actually calm down and relax so you can get a true reading. Again, be sure that you ask your client beforehand if it's okay if you actually physically touch them. Go ahead and lay back down, please. Another common error is when switching legs, we do not want to have the client lower both legs. This puts a lot of strain on the low back and it feels very uncomfortable. So what we do to help out is we can switch legs in the middle of the test, like so. Relax, great. And then also we can stand up from this position, or if they don't feel comfortable, we can grab both legs and stand up as well. If you have a client that may be wearing some compromising clothing, it might be a good idea to help them cover up as well. So having a towel on hand to cover up sensitive areas may also be recommended. What we're looking at in the Thomas test are a few different things. First of all, we're looking at the flexibility of the hamstrings, whether or not this client's able to pull the knee to her chest or not. So we can see that she's able to pull the knee to her chest. The second indicator that we're looking for is hip flexors. So is her knee up high, showing that she has shortened hip flexors, or is her knee in a nice relaxed position with a downward angle? The next thing we're looking at is the rectus femoris, and we look at that through the knee joint. Is her rectus femoris shortened or tight, or is her rectus femoris in a proper position at 80 to 90 degrees angle? Looking at is internal or external rotation of the femur. So we will look to see if this bone is externally rotated or internally rotated.